back by popular demand is Dr. Shane Creado, our sleep doctor. Dr. Creado is a board-certified psychiatrist and sleep medicine physician. He was wildly popular on the last time he was on. He did his undergraduate degree in physical therapy and then went on to do his medical degree, graduating at the top of his class, received the gold medal for obtaining honors in every subject in medical school. He has clinical experience with veterans, with college mental health, exercise, prescriptions and mental health, comorbid psychiatric and sleep problems, which he does for us, CBT, insomnia, cognitive behavior therapy for insomnia, alcohol recovery groups, mindfulness-based stress reduction, administrative psychiatry. He's got loads of experience. Couples therapy, regressive hypnosis, which I think is just really fun and awesome. He is also the creator of the Amen University course, Overcoming Insomnia. He's the author of a new book, Peak Sleep Performance, the cutting edge sleep science that will guarantee a competitive advantage, which debuted at #1 new release on Amazon in sports medicine in March 2020. So Shane, we are so grateful you're back. He's one of our lead physicians in our Chicago area clinic.
Yeah, no, I'm really excited to have you. This is always you're one of my favorite guests, and it's one of my favorite topics because it's just such an important one. And I know our community, especially, I know my community for sure, really struggles with this. And because we are at that age, we are female and at that age. and we're going to talk about some great topics today, but I would love for our community, if you would, please post not only what the struggles have been going through all this, with the pandemic and the riots and the fear, post what your struggles have been, your questions, your concerns, but also tell us what you learned. Because Dr. Creado is just masterful. And he's taught me so much, and I thought I had researched a lot on sleep. It's not even close. So it's really interesting. We would love to hear from you. And if you would, take a screenshot of us and send it to us. That'd be awesome. And tag us in it, please. So thank you and welcome.
Saying I'm so cute?
You're so cute.
You want a screenshot?
And Dr. Creado is so cute. Yeah. So thank you and please and welcome, Dr. Creado.
Thank you so much for that generous welcome. And it's good to see you both again.
Well, life is becoming a Zoom experience, video conferencing. And, I hate the term social distancing because it's a bad term, because we should be socially more connected than ever so we don't get depressed. But physically distancing just makes so much sense so we don't empower the coronavirus to, keep spreading and doing damage around the world. One of the big things that's happening with the pandemic is people are not sleeping. Their nightmares have gone up. They're afraid. And the incidence of post-traumatic stress disorder is going up as well.
And the riots, I think, are adding to that. Not the protesting, but when it gets violent, I think people are afraid.
Well, and then, of course, that's where their news is going to focus on whatever bad things happening. They're going to focus on that, making it seem like something that is local is global. And whenever you see something terrible as global, your anxiety skyrockets. So from a sleep perspective, and also working with us at Amen Clinics, what are you seeing, Shane?
We're seeing that anxiety levels are skyrocketing. Even people whose other psychiatric disorders were well controlled, they're having more frequent episodes, severe episodes as well of those mood symptoms. And because if they're in danger mode, they're anxious, they're worried, they're on edge, their sleep will be affected. The Dalai Lama once said that sleep is the best meditation. And if you're in danger mode, your brain is obligated to protect you. Sleep is the most vulnerable thing we do, so you will be more likely to be awake, on guard, on edge, and your sleep will definitely suffer. The problem is, if your sleep is devastated, if your sleep is fragmented, you're more likely to have manic episodes, more likely to have severe depression. And of course, PTSD and sleep are very closely related to one another. So you'll be worrying, your brain won't be able to shut off, then you will be catastrophizing about the worst case scenario. And then when that happens, you're going to get poor sleep, you're going to recover very poorly the next day. It's going to set you up for failure. And we see that on the SPECT images as well. The rational part of the brain shuts down, the emotional circuits are overloaded and in danger mode, and it just sets up a vicious cycle because the more anxious you are, the less sleep you get, and then the more anxiety you get and the less sleep you get. So with PTSD, post-traumatic stress disorder, where people have experienced a really traumatic event or they've witnessed it, the danger mode in the brain is really a significant factor that devastates people's sleep. The other thing, of course, is nightmares, where they have a strong negative emotional response accompanied by an awakening. If you are sleep deprived, your brain needs to drink as much dream sleep as possible to catch up. So inadvertently, you end up getting more nightmares simply because you are sleep deprived because of the anxiety and PTSD. It's called REM rebound in sleep medicine. People with PTSD are also more at risk of sleep apnea, obstructive sleep apnea, leg and arm twitches, which lead to further sleep fragmentation. They're afraid of going to sleep, especially if trauma has occurred around the bedroom or at night. So they will want to do perimeter checks to make sure things are okay. They may avoid the bed because of the nightmares and the trauma associated with the bedroom. That again causes sleep disruptions. And medications, of course, can affect your ability to fall asleep. Medications that treat anxiety disorders like PTSD can worsen sleep apnea, like benzodiazepines. Here at Amen Clinics, we know that benzodiazepines are maybe medications of last resort because of all the damage it can cause to the brain. So those are the ways in which PTSD can really impact your sleep.
What are things people can do about it? So if they have had PTSD before, robbed, raped in a fire, grew up in a traumatic environment, had been molested, and what we see on scans is their emotional brain is heightened, and so they can't stop thinking about the traumas from the past, which will interfere with sleep. What are some of the strategies that could help them?
So there's psychiatric strategies and there's sleep strategies. We know that we recommend trauma-focused CBT, we recommend EMDR therapy, certain medications for the psychiatric component. As far as the sleep component is concerned, for the hypervigilance, for the danger mode, calming strategies, progressive relaxation, scheduling a worry time earlier in the evening, identifying negative thoughts that are unreasonable or irrational, and working on those through cognitive behavioral components. In the Overcoming Insomnia video series, we touch on some of those strategies to calm the busy brain down. So that's as far as the relaxation, the hypervigilance is concerned. The other piece is to avoid the urge to constantly look for danger at nighttime. So for patients who perform safety checks all the time, refraining from doing so will initially increase their anxiety, but over time, the anxiety will reduce, the checking behavior will be extinguished, and sleep will improve.
She's kicking me under the table.
No, you're hitting me under the table. I don't see how that's going to make people who need to check feel more secure.
Well, let me give you an example of
we
this.
need a little therapy here.
No, we don't. This is about them. This is about them.
She was
funny.
actually doing really great
The quarantine was fun.
during the first part of the pandemic. She was, because she's a prepper. She's prepared.
And I felt empowered.
And she felt empowered. But when the social upheaval started, she began to
I wanted a bunker.
unravel a little bit. Now she's checking, and she was actually, during the beginning, I was watching the news more. I turned that off. And so when the whole George Floyd killing and the riots and all of that, I had trained myself to stop checking. And now she's checking, and all of a sudden we're moving.
Which goes to show you, but that goes to show you for everybody
to
listening.
Montana or something.
Yeah. Well, it goes to show to a bunker somewhere. Yeah. So it goes to show you where that everyone is sort of triggered by something different. Clearly, the illness was more of a concern for you, but we've all got our own issues. Things trigger us differently, right?
Yes.
So traumatic and violent things are what trigger me far more. I'm a nurse, and so like being able to kick into my nursing mode, I'm like, oh, I got this. But I didn't got it for the other thing. And I'm like, well, I don't have an answer for this. This is not, I feel out of my element. And I think a lot of people are experiencing that. One or the other they can handle. Both is like tilt overload.
Right, exactly, Tana. And if it's not affecting your ability to fall asleep, then that's going to be something that's okay for you. But if it affects your ability to function or fall asleep, then it's a problem.
And I did notice to a credit to what you're saying, immediately when I forced myself to not look at the news, I'm not going to say I didn't do perimeter checks, but when I stopped watching the news and started making my mind focus on positive things that are meaningful to me, like my church services, like my brain went to a totally different place and I slept like a baby.
In the next podcast, we're going to talk about the impact of pain on your sleep. But in the last minute, Shane, can you just give people, if they've had emotional trauma, I know there's a medication, prazosin, that we use sometimes to help decrease nightmares, and you use that a lot. But give us like just 2 or 3 strategies if you've had PTSD or you're struggling with it now. What are the most important things you can do to help improve your sleep?
Well, for the nightmare component, there's a few really helpful strategies. In addition to the calming the brain down, stopping the perimeter checks, one is a grounding techniques. So when you awaken from a nightmare, it's associated with confusion. So grounding techniques might include looking at a calendar upon waking up to reorient yourself, holding a special object that has emotional significance for you. So you get back to the moment and you realize that was a nightmare and this is now. And you got to break that cycle, that thread of thinking. That's really going to be helpful for people to break that aspect of functioning. If you are waking up in a panic, don't stay in bed. Get out of bed, listen to calming meditation. We have some great ones on Brain Fit Life or other strategies. Once you calm down, then go back to the bed. Otherwise, you're lying in bed worrying, associating the bed with that trauma. And eventually the bed will be a traumatic place for you to be in. So some people with PTSD, they come to a clinic in Chicago from other parts of the world and other parts of the country, and they say, I slept the best I've slept in years. Because it often happens that their bedroom or the bed is now associated with the trauma. So break the cycle, grounding techniques, relaxation, recalibration.
And then you and I created a pretty cool supplement called Put Me to Sleep. Which is what people want. They want to go to sleep. And it is just, it like sold out, but now it's back in stock, thankfully. Talk about Put Me to Sleep and why that is one thing that can be part of a good sleep regimen.
It's a beautifully balanced supplement. And we worked in it for a couple of years. And it has low dose melatonin, so it doesn't knock you out. It helps your brain drift into sleepiness very gently. It has GABA to calm those basal ganglia down, which are your dangerous stress circuits. There's 5-HTP to help boost a little serotonin to help you with stress tolerance. B6, and generally what it does is it allows the brain to calm down gently. Take it 30 to 60 minutes before a desired bedtime. You have a nice wind down routine, and it just helps embolden and strengthen your natural biological circadian rhythm to function more effectively. So it's beautiful. It's very well tolerated. My patients, none of them have woken up with a hangover or tiredness. They wake up feeling good. The quality of sleep has improved.
Yeah, no, it's so effective. All right, when we come back, we're going to talk about pain and sleep. So important. Stay with us.
Welcome back. We are still here with Dr. Shane Creado, one of our Amen Clinics doctors who we just love. So knowledgeable in sleep. And so if you are struggling, please listen to this. Also, one thing we didn't really, I think, emphasize enough is the sleep course we had that Dr. Creado did, because it's just filled with fascinating. And every time I hear you talk, there's just more that I learn, because I realized there was so much to take in. I didn't take it all in the last time. So it's a great course. And your new book, so it's Peak Sleep Performance is the name of the book, correct? Well, thank you so much for being here. And one thing I wanted to just touch on really quickly before we jump into the topic of pain. In the last episode, we were talking about Put Me to Sleep, the supplement that you guys created over a couple of years. It's fascinating. But one thing I wanted to mention as you were talking about it, why it works well is because it settles the brain down. If you talk to people who, especially through this time, alcohol has gone through the roof, right? Smoking weed has gone through the roof. And it's because people can't shut their brains off. I hear them. I hear them all the time. They're on my page. I can't shut my brain off. I'm nervous. I'm too anxious to go to sleep. So what I'm hearing is that combination sort of gives you that same effect, but without the toxicity.
Exactly. And that's what's so beautiful about it. It's because it allows your brain to calm down so you can actually fall asleep. The harder you try to sleep, the more likely you are to fail. Mm-hmm. And along with those strategies in the book on the Overcoming Insomnia video series to calm the busy brain down, whether it's relaxation or breathing, paradoxical intent, irrational versus rational thoughts, all those things will help you get into the mode of getting relaxed, getting your brain to wind down nicely rather than just hoping it's going to shut on and off like a light bulb, which it's not going to do.
Right.
So we're going to have links to Put Me to Sleep, to Dr. Creado's new book, to the course at Amen University. But what did you learn in the first podcast? Please post it on any of your social media sites, take a picture, send it to us. Also, leave comments, questions, concerns. And if you leave a review for the Brain Warriors Way podcast, then we'll enter you into a drawing for Tana's cookbook, the Brain Warriors Way cookbook, or if you'd rather, have The End of Mental Illness, my book. So we love reviews. So let's talk about pain. And it is just such a huge problem. I mean, a lot of us, as we get older, we have issues with pain. I know for me, I take omega-3 fatty acids, I take brain curcumins and SAMe, and my knees don't hurt. I hurt my knees playing football in college, intramural football in college. And so I have chronic knee pain if I'm not taking my supplements. Or I also notice if I eat sugar, that pain levels go up. But, you know, people who've been in accidents, people who've had surgeries, the issue of chronic pain is huge and clearly can have an impact on sleep.
Yeah, no, I have a back problem as well. And what I noticed through the quarantine, I made sure I exercised, took my supplements, but because finding the food you normally eat was a little different. We didn't have the exact, food we normally eat at our disposal and fingertips initially. We were eating a little more rice and things like that, which we don't normally eat to supplement. And I noticed immediately my back hurt more.
Because rice almost immediately turns
Right.
to sugar
Just the more carbs.
in the body, as does bread, pasta, and potatoes.
Mhm.
So,
And more inflammation there.
Right.
and that goes with inflammation, which if you already have vulnerability, like you were born with scoliosis
Mhm.
and you were in a bad car accident,
Mhm.
that chronic pain can really
Right. Get triggered.
get triggered.
And it affects my
easily.
sleep. No question.
So when we think
So
about
what do people do? Is there anything different they might do to manage their sleep with pain?
yes, there are specific strategies that they can do. Avoid resting in bed. So when you're in pain, you will feel that lying in bed while you're awake may be far more restful. But the truth is, if you want to rest, you got to do it out of bed. Because if you lie in bed awake in pain, you're going to associate the bed with wakefulness and with pain. The bed is a place of safety and sleep. So there's a clear distinction between resting and napping. Most people may get confused with those. So if you want to rest, avoid resting in bed, number one. Number two, some people like doing progressive muscle relaxation strategies to meditate, to calm down, to wind down and go to sleep. But you might want to use a modified technique if you've had an injury, because tensing up the muscles and relaxing them in a painful region may worsen your pain and inflammation and consequently affect your sleep. So you can avoid tightening the muscles too much or choose a different relaxation technique, like breathing or just guided imagery or other strategies. A lot of people with pain might be afraid of sleeping too soundly because they may wake up really stiff and painful. Morning stretching may be helpful for the stretching, for the soreness and the stiffness. But remember that if you don't get enough sleep, then you will feel less alert, more lethargic, and your sensitivity to pain will be increased. So if someone is well rested and they perceive their pain to be 5 out of 10, if 10 is the worst, if they're not well rested, they might perceive that same pain to actually be 8 or 9 or 10 out of 10. That's dangerous because they might require higher doses of pain medications or muscle relaxants. But we also know muscle relaxants can worsen your incidence of sleep apnea. Opioid pain medications are devastating to the brain. They can worsen the risk of central sleep apnea. So the more sleep you get, the more pain tolerance you have, the less doses of those harmful medications you need to take.
Mhm.
The timing
And
of
if you-
physical activity is also important. So stretching before bedtime,
Mhm.
but not vigorous exercise before bedtime. And the amount of physical activity. So if you're in a PT program because of an injury, do it several hours before your desired bedtime. You'll be able to sleep better. You'll be recovering faster. There'll be less inflammation because you're getting better sleep. And your rehab will be quicker to progress.
Mhm.
Let me tell you a story about chronic pain. So I first got interested in it when I first started doing SPAC. A police officer, his name was Steve, was admitted to the hospital after a suicide attempt. And I was really fond of him. He had had 6 back surgeries after 2 car accidents where he was involved in chases, where he was chasing the bad guys. And he said, I just could never get away from the pain. And the opiates helped him in the short run, but made it worse in the long run. And when I scanned him, his cingulate gyrus was the hottest I'd ever seen to that point. And when your anterior cingulate, it's in the frontal lobes, deep in the middle, is overactive, people tend to get stuck on negative thoughts and negative behaviors. And what I did is I put him on an SSRI to calm it down, I think Prozac at the time. And he felt so much better. And what he said that was really interesting, he said, I still have pain, but I don't think about it all the time. So the obsessional quality with the pain went down. So now I might put him on serotonin mood support, or on happy saffron. But the 5-HTP in Put Me to Sleep really helps that obsessional quality. We often say it's like you have a little mouse in your head on an exercise wheel, and the mouse can't get off. It's just going over and over, and it's really angry, and it's screaming at you. And, often people get the mouse drunk or they get the mouse stoned as a way to shut it up. But there are other strategies that can help.
I've often thought about, in relationship to what you're talking about, if you think about something, because I've experienced a lot of pain for various reasons, but you can be, it's almost impossible not to focus on it when that's what you're, when that's all you're sort of have right then. You're focused on the thing that is requiring the most attention. And so if you notice, like I've heard a lot of people say this when talking about pain, all of a sudden they get distracted by something. Their kid comes in the room, gives them a big hug, or has a problem, and they forget the pain temporarily. So like, it's not like it's gone, but it's just, you're not focused on it. So it would seem to me like doing things that would switch your focus would be very helpful.
Yes. That's observer bias, right? So the more you focus on something, the more amplified it becomes. So distraction techniques, coping strategies, understanding that there are ways in which you can help with pain and with injuries. So we always go with the price routine for any injury: protection, rest, ice compression, elevation. I want to talk about prices, where you add the sleep component as a crucial part in the overall recovery from injuries and maintaining a good pain tolerance too, because you'll have less inflammation, less stress hormone levels like cortisol, higher levels of testosterone and muscle building hormones, better pain tolerance there. And the areas of the brain that help you manage emotional things and pain and rational thinking can be improved. The prefrontal cortex, the temporal lobes, the deep limbic system, the anterior cingulate gyrus, and the basal ganglia on our SPECT images. They can improve through better sleep and better pain tolerance.
One thing I want to talk about before we have to stop is hypnosis. And, you have experience with it. On Brain Fit Life, there's actually a hypnotic exercise I do for people in pain. And so ultimately, pain is experienced in your brain, and calming the anterior cingulate along with the insular cortex, which is between the frontal lobes and the temporal lobes. That's often where pain is experienced. That when that's high, people have this high sense of angst and unhappiness. So angst is actually the best word to think of for the anterior insular, that putting someone in a hypnotic trance and giving them helpful suggestions to turn off the pain can actually be helpful. Do you have any experience with that?
Absolutely. So I trained in hypnosis and also in neuro-linguistic programming. And through certain suggestions, you can actually reduce the subjective sensation of someone's pain. I once did a fun exercise with a patient who had overeating, and she felt like she had eaten a burger after the session. And the person is still awake and they're completely in control. And you can reduce the pain in actual time. You fill out a pain form before the session and after the session. And most of the time, it's reduced by over 50% within 20 minutes.
I didn't know you did NLP. I'm fascinated. I love NLP. I love it. I think it's a powerful, powerful technique.
Very powerful.
Yeah.
Yeah, no, he's one of us.
That's
all right.
Awesome.
When we come back, we're going to talk about sleep and work performance. I mean, your new book is on peak performance, peak sleep performance, the cutting edge sleep science that will guarantee a competitive advantage that you can get on Amazon, or Overcoming Insomnia at Amen University. It's just spectacular. If you're having trouble with sleep, this can help optimize your sleep for the rest of your life. It's a great investment. Also, you can get Put Me to Sleep on brainmd.com. Stay with us.
Are you looking for ways to heal ADD, enhance your memory, conquer anxiety, depression, insomnia, autism, and other conditions? Hi, I'm Dr. Daniel Amen. We provide courses based on what we've learned over 30 years of clinical practice. We also offer accredited courses geared to physicians, therapists, and students looking to get ahead. Are you ready to change your brain and change your life? Get started today.
We are here with our friend and colleague, Dr. Shane Creado, psychiatrist, sleep medicine specialist. He and I consult on a number of our high-profile patients. So grateful for your help with Justin and his sleep issues, which was a major problem when he first came to see us.
Yeah.
And in this episode, we're going to talk about performance, work performance, athletic performance, and the critical role of sleep.
So before we get started, I would love to know from our listeners and our viewers, what did you learn in the last two episodes? And because I have just learned so much. We'd love to hear from you. We'd love to get your questions, your concerns, what's bothering you. We love to answer them and base our podcasts on it. And if you wouldn't mind leaving us a review, we love that. It's very special to us. BrainWarriorsWayPodcast.com. You can leave a review. And please post, tag us. And if you wouldn't mind taking a screenshot, that's really fun for us to see. And welcome, Dr. Creado.
Thank you so much for having me.
So let's talk about performance. When you sleep, your brain cleans and washes itself, sort of takes out the trash from the day before. And people who sleep less than 6 hours a night have lower overall blood flow to their brain, which means their brain's actually not taking out the beta amyloid trash, which is one of the proteins that builds up in people with dementia. And this one study just blew our mind. You remember the study on soldiers where
yes.
Soldiers who got 7 hours of sleep were 98% accurate on the range. Soldiers who only got 6 hours,
one less hour,
were 50% accurate on the range. Those who got 5 hours were 38% accurate. And those who only got 4 hours a night were dangerous. They were only 15% accurate on the range. So obviously sleep and performance go hand in hand.
Definitely. And interesting, you mentioned reaction times. One night of sleep deprivation can reduce your reaction times by 300%. So there were actually studies comparing sleep loss to the equivalent of alcohol consumption. And they found that when you sleep 4 hours or less, it's like drinking 4 to 5 alcoholic beverages. You're legally drunk. How is that going to work for you when you're a sleep-deprived medical professional working a 36-hour shift, or when you're involved in a dangerous job? You're much more likely to get injured.
Well, we need to talk about that, because when we were interns, and it was much worse when I was an intern than when you were
I was
an
a nurse,
intern,
it was really bad.
right?
Yes.
Because they didn't care at all about our level of sleep. But I knew intuitively that I was dangerous, that if I hadn't slept for 2 days, and I remember I was on the oncology ward and I had a patient that was bleeding, and all bleeding out, and I was just completely confused. And it's 2 o'clock in the morning, and I'm just like screaming, "You guys have to help me because I'm confused." And it's still
we had two
traumatic
surgeons on our unit, because it was a trauma unit. Two of the surgeons that I saw when I was there that collapsed on the floor. One ended up triggering a seizure disorder. That from that point on, he ended up having seizures. It was really crazy. Yeah, that can ruin your whole career. So if you're a surgeon.
The thing is that there were studies done on medical interns, and some of those studies results show that if people have had one overnighter when they were working overnight on call, they commit 36% more serious medical errors.
Yeah.
300% more medical errors in general that lead to death than those who work 16-hour shifts, although 16 hours is a lot. Compared to overnight shifts, they have so many more dangerous situations. People can lose their lives.
Mhm.
There's traffic accidents that occur as a result of sleep deprivation, over 6,500 fatal accidents in this country. There was another study that was done, and that was in the Harvard Business Review, that showed if a medical professional worked 24 consecutive hours, the risk of stabbing themselves with a needle or scalpel increased 61%.
Yeah,
Crashing a motor vehicle, their risk
it's
increased
interesting
by
you said that.
Well,
almost
that
20%.
was, so when I was an intern, AIDS had just skyrocketed. It was 1982, and I was sticking people with AIDS, and I knew that if I stuck myself, that I was in big trouble. And so I spent that year freaked out a lot.
I actually I did a double shift and was taking care of a guy who was known for doing a lot of drugs, dealing a lot of drugs. He was in for a gunshot wound. And the guy had no original blood. I mean, we had basically had to transfuse so much blood because he almost died. He coded several times. But I was sleep deprived. I did a double shift and I stuck myself with a dirty needle and the guy had Hep C. So I had to go through a ton of testing. Yeah, that's a scary moment.
Yes. Very scary. And people can lose
Okay,
their
so we
lives.
made the point that your performance will be better. And it's, I told you about being a consultant for the NBA. I worked with NBA referees for a year. And my first thought with these guys was these guys are all sleep deprived because they are forced by their contract to work a late night game and have to take the first flight out to the next city in the morning. So basically they're 2-3 hours of sleep at night. And then, yes, they try to nap during the day. But, it was my big issue with my friend Bob Delaney at the NBA. It's like, we need to work on their sleep.
I completely agree. And in the book, Peak Sleep Performance, I mention the NBA and the important job we have to improve people's lives, outcomes, the risk of injury. Everyone wins if you get more sleep. Less injury, longer playing careers, records will be broken, quicker reaction times, quicker recovery from concussions.
So what are strategies? So I think we've made the point. If you don't sleep, you're going to be less effective in sports, at work, probably in your relationships as well, right? Everything with your health, right? Because if you don't sleep, and is it 6 hours or 7 hours? What is the optimal sleep? I know it's probably different for different people, but what do you think based on the research?
Well, it's anywhere between 7 to 9 hours if you're an adult. If you're a teenager, it's probably more around 10 to 14 hours, depending on how old you are. But each one's brain is different, as you said, in the absence of other complicated issues that impact your sleep. And if you're waking up feeling refreshed and you're not feeling really sleepy and you need to take a nap during the day, and you're not catching up on sleep in the weekends, if you're getting 7 hours, that's probably good enough. If you're getting 8 hours, that's good enough if you're not feeling sleepy or dysfunctional during the day or catching up on the weekends.
Mm-hmm.
So on average, in 1900, Americans got 9 hours of sleep at night. In 2018, on average, they get 6 hours and 40 minutes. And, I think it's one of the reasons mental health problems are skyrocketing. And health problems are skyrocketing because if you don't get good sleep, then everything else in your life sucks.
I have a question. How does age affect your tolerance for lack of sleep? Like, I noticed when I was younger, I could do a double shift. Yeah, I'd feel awful the next day, but I could do it. But as I get older, I just don't have that reserve. And so I'm wondering if that's a me thing or an age thing.
That is generally the older you get. There's so many other things that impact our functioning. It's not just, oh, we're young, we can do it, but there's inflammation, there's arthritis that kicks in, there's hormonal imbalances. And because even if you get less sleep, this less sleep impacts your hormone levels more, your inflammation more, your pain tolerance more, your mental health reserve more, and it's going to be more impactful in terms of your functioning. So what you're experiencing is pretty consistent.
Yeah, I need 8.5 hours, and I know that. And if I don't get it, I just don't feel right.
All right. Yeah. So people are getting that if you're not sleeping 7 to 9 hours, it's a problem for so many different things. But let's give them as many practical tips as we have. And I always say brain health is three things. One, you have to have brain envy, you have to care about it, avoid anything that hurts it, do things that help it. I mean, that's ultimately, I can summarize my 40 years of work in 3 words: care, stop, do. Care, stop, do. And so I often think for sleep, it's the same thing. You have to have sleep envy, really care about it, avoid things that hurt it, caffeine, nicotine, exercise before bed, eating before bed, alcohol, benzos, opiates, marijuana, because they will fragment your sleep. And then do things that help it. Cooler room, a dark room, a quiet room.
Prayer
and meditation, put me to sleep, can be very helpful. What am I missing in that? What would you add to that frame?
What you can do as an individual is nap, but nap strategically. We always talk about napping being disruptive to your rhythms, but if you are partially sleep deprived, a nap at the same time every day can be potentially very helpful for your brain. When NASA studied pilots, they found that a 26-minute nap increased your alertness by 54% and performance by 34%. Now, strategic napping means at the same time every afternoon, because there's a natural dip in melatonin, there's a dip in your functioning, there's a slight increase in melatonin. So if you're napping, same time every afternoon. Number 2, it should be around 20 to 30 minutes, not longer. If it's longer, you'll be waking up out of a deeper stage of sleep and you'll feel super groggy and tired. But if you're waking up within 25 minutes, that's half a sleep cycle. You wake up refreshed and energized. It's either a 25 or 30-minute nap or a 90-minute nap. But I'd avoid the 90 minutes because that can sabotage your nighttime sleep.
That's so interesting. And you just said something really interesting to me. See, again, I learned something new. So I always hear people say, well, I have to have an afternoon cup of coffee, because you hear so many people say it, right? And we know your food affects you. But what I heard you just say is that melatonin peaks for a short time in the afternoon. I didn't know that. That's fascinating.
And if you want to block that,
so it's normal.
Have no carbohydrates at lunch if you want to block it. Because what I've seen is if you have a sugar burst, that's actually going to cause a lull in your blood sugar. So if you have a bowl of pasta or, rice bowl at lunch, then that insulin is actually going to drive serotonin into the brain and you'll be happier, but also sleepier, because serotonin then turns into melatonin.
Oh, okay.
Right? And so you have to be careful with carbohydrates at lunch.
Light bulb moment.
Now, one of the other things I want to just show people, we have a bright light. BrainMD has the Bright Minds bright light therapy lamp that 20 to 30 minutes in the morning helps to reset your circadian rhythm. And for people who have trouble sleeping, I use this all the time for my patients and actually light the set because then I'm getting 20 to 30 minutes in the morning when I'm recording, and it's been shown to support mood, focus, energy, and healthy sleep.
That is such a great device, Daniel. We have it here in Chicago as well. And it causes your melatonin to be suppressed, so you'll be more energized in the morning. In the morning, if you combine that with deep breathing or jumping jacks, get the blood flow going, get the melatonin to be suppressed, it's going to boost your energy levels and concentration and mood.
Right. When we come back, we're going to talk about middle-aged people, hormones, and insomnia.
Don't forget to post
one secret on why 40-year-old women are irritable, drink more, and can't sleep.
I already know the answer to that. But don't forget to post what you've learned. I learned so much. I always thought that the carbohydrate issue was just a blood sugar issue. I didn't even think about the serotonin turning to melatonin. So interesting.
Stay with us.
Welcome back. We are still here with our friend and colleague, Dr. Shane Creado, one of our Amen Clinics doctors, amazing doctor, also a sleep specialist. So you're board certified in sleep medicine, correct?
Yes, that's right.
And the course, I love the course about
Thank
sleep that we have on Amen
Overcoming
University.
Insomnia.
Yes. And your book is amazing. So
Thank you.
Sleep performance, the cutting edge sleep science that will guarantee a competitive advantage. And he also helped us develop Put Me to Sleep that I just love. It's, I think, one of the best supplements we've ever designed. We actually have a special going on with Put Me to Sleep and Happy Saffron.
Nice.
And I don't know if I told you about, we're starting a new study on female sexual function and Happy Saffron, because we now have 4 testimonials that it's basically Viagra for women. So we'll see. That's why you have to do the studies. In this episode, we're going to talk about middle-aged people, hormones, and insomnia. What can you do? And
besides progesterone, I would be on the evening news if I did not take progesterone. But not everybody can take it.
so what many people don't know is, people think of 50 and menopause, but about 10 years before women go into menopause,
Started at 40.
progesterone starts to wane.
Mhm.
And then when progesterone is the brain's sort of natural Valium,
Mhm.
and it calms things down, but women don't know that it's the progesterone issue, and so they start drinking more. Alcohol is a way
Because you're
to
agitated.
manage it. They go to the family doctor and end up on an SSRI, an antidepressant, or they're taking Xanax, or they're getting a prescription for Ambien to help them sleep. And I know, Shane, you're a really big fan of Ambien.
Hardly.
It's so funny. The pain doctors are not fans of opiates, and the sleep doctors are not fans of the most commonly
Right.
prescribed sleeping pills. What is this?
Because they know. Yeah.
No, I mean, it's just
Ambien made me
like
depressed.
knowing the research is not getting to the primary care physicians.
Yeah. No, when I was going through my divorce and I couldn't sleep. I was very, anxious and agitated. And the doctor gave me Ambien. I took it for 2 nights and I realized it was making me super depressed and teary, emotional. I was like, what is happening right now? It was very weird. Yeah.
The benzodiazepines that are used for sleep can increase your risk of dementia, and it's like medicating with alcohol. The over-the-counter sleep medications can increase your risk of dementia again because of the anticholinergic properties and worsen restless leg syndrome, cause weight gain, which leads to more risk of sleep apnea and further insomnia. So all those meds are just prescribed without really understanding the underlying biology and how it damages people's brains and health in the long term, which is what's so tragic about the whole thing.
So what can people do? And I imagine, although I don't know this for sure, so this is a question, when testosterone starts to go low, because it also starts to go low in your 40s, does it affect sleep?
Testosterone is an anabolic hormone. It helps you build muscle. And when you are sleep deprived, your testosterone levels will decrease. Studies have shown that men who get less than 6 hours of sleep a night, their testosterone levels are equivalent to someone 10 years older than them. So if you're 40, you'll have testosterone levels like the guy who's in his 50s. If you're 50, testosterone levels to someone in their 60s or 70s. So testosterone levels will reduce and estrogen and progesterone levels too. So actually being chronically sleep deprived will bring on earlier menopause in people and cause further hormonal disruptions. And not only that, cortisol levels will increase, stress hormone levels will increase, everything you consume will turn into fat. And we know the fat cells in our body convert testosterone to estrogen, which further fuels weight gain. The hormone leptin, which regulates your appetite, is disrupted, and you'll have more need to consume calories. So you'll feel hungrier, you'll gain more weight, it'll cause further sleep fragmentation. So testosterone levels will decrease if you get chronically less sleep. But the good news is, if we use external factors to synchronize our rhythms better the older we get, we can keep and maintain those hormone levels. We can reduce inflammation and we can boost our outcomes. Yeah, the older you get, more sleep problems you will have because you'll have more pain syndromes, more weight gain, higher risk of sleep apnea, more inflammation. People are on medications, more and more medications, which cause further sleep disruptions depending on what those medicines are. And in the elderly, if they have eye problems or cataracts, it might affect their circadian rhythm, the light and the melatonin response. So providing things like a good quality supplement that helps heal the brain rather than sabotage the brain, like put me to sleep, or light therapy in the morning to suppress the melatonin and get you ready for the day and improve your energy, having regular sleep schedules, whatever they might be, that's going to really be very important in maintaining those gains. So yeah, people assume sleep fragmentation is a natural consequence of aging. It does not have to be that way, because we've seen on the SPECT images, people who are sleep deprived, the same areas that are affected in chronic dementia are also affected. So if you do get better quality sleep and maintain it, it's one of the best modifiable strategies to prevent dementia in the long term too.
So if I'm hearing you correctly, it's sort of a vicious circle.
It really is.
Your sleep is affected by your hormones, but then that affects your hormones and your weight, which then affects your sleep.
Exactly.
Is that correct? Yeah.
And so what can women do? I mean, for men too, but, you know, menopause, perimenopause, hot flashes, sleep disruption. So you could work with one of our integrative doctors with bioidentical hormone replacement. But from your standpoint as a sleep physician, you're dealing with someone 40, 50, they're not sleeping, they have hot flashes. What do you recommend?
50% of them will have middle of the night awakenings. Around 1/4 of them will have difficulty falling asleep or staying asleep. So what do I recommend? Fixed wake up times, fixed bedtimes. If you can't fall asleep within 20 minutes or so, get out of bed, read a boring book, calm your brain down, then get back to the bed. Keep your wake up time the same time every day, because even if you woke up in the middle of the night and you're partially sleep deprived, by the time night comes around the next day, you'll want to go to sleep on time and your brain will be making up for that lost time. So you'll slowly start consolidating your sleep and your wake cycles.
So I know we've talked before about keeping the room cool. I know for me, it's the stage where the hormones are wacky and can't stand it. And then on top of that, having high thyroid. So I have to keep the room at like 68, 69. So he has to dress like a polar bear to go to sleep. But it really helps my sleep a lot. And I know there are things like cooling blankets and things like that I've heard a lot of women say just are lifesavers.
What about cooling pillows? That's a thing, right?
I haven't heard of cooling pillows. I should look into that.
No, I don't know.
Yeah, no, I've heard of them. Well, this is just so helpful. Any other tips before we leave our second go round at Sleep Week?
Just start working on it now. If you don't have a sleep problem, now is when you consolidate your sleep and maintain it so that you reduce the risk of developing a sleep problem. And if you do, it's going to be less severe and you'll know what you need to do to boost your sleep. So just as we work with our athletes on nutrition and mental conditioning coaching and training, we need to work with every single person on sleep optimization, whether or not you think of you have a sleep problem, so that it's going to be one of the best buffers against sleep problems in the future, boosting work performance, and maintaining your mental health.
So, you know, I just had this crazy idea that we should actually do 1 month for each of the 11 Bright Minds risk factors, because clearly we should have a month focus on sleep. It is so important. But all of the risk factors are important, right? And if you don't sleep, you have lower blood flow to your brain. So that's the B in Bright Minds. It prematurely ages your brain. That's the R, retirement and aging. It increases inflammation in your body. It turns off 700 health promoting genes. So the G is genetics. If you don't sleep, you're much more likely to have a head injury. You'll be more likely to consume toxic products like alcohol and marijuana because your decision making will be poor. You'll have more mental health issues. You have more diabetes. It turns off your hormones. Basically, if you don't sleep, it affects all of the Bright Minds risk factors. And so please, if you're having trouble sleep, pick up Shane's book, Peak Sleep Performance. You can get it on Amazon. We'll have the link on the Brain Warriors Way website. His course, Overcoming Insomnia. If you struggled with it and it just hasn't worked, please don't take Ambien, take the course. And he's also the co-creator of Put Me to Sleep, the supplement at BrainMD. Shane, we love
Such a
you.
pleasure.
We love having you part of our family. We are just so grateful for our friendship and collaboration. Thank you so much for being on the Brain Warriors Way podcast. And if you learned something from Dr. Creado, please post it on any of your social media sites. Take a picture of that and send it to us. Also leave us a comment, question, or review on brainwarriorswaypodcast.com. We'll enter you into a drawing for either a copy of The End of Mental Illness or the Brain Warriors Way cookbook. We just went over 8 million downloads for the Brain Warriors Way podcast. We are so grateful to all of you who listen and share it.
Thank you so much for having me. It's always a pleasure, and hope to see both of you soon.
Thanks.
All right, my friend. Bless you.
If you're enjoying the Brain Warriors Way podcast, please don't forget to subscribe so you'll always know when there's a new episode. And while you're at it, feel free to give us a review or 5-star rating, as that helps others find the podcast.
If you're considering coming to Amen Clinics or trying some of the brain healthy supplements from BrainMD, you can use the code podcast10 to get a 10% discount on a full evaluation at amenclinics.com or a 10% discount on all supplements at brainmdhealth.com. For more information, give us a call at 855-978-1363.